Midwives Uncut.
Hey, welcome to our newest episode of Midwives Uncut. Today we are going to be talking about, we get a lot of is it safe to do a hospital or out of hospital birth? Maybe I should be in a hospital.
And at least for the first time.
For the first one, right. So what we wanted to touch on in today's episode is our profession, right? And how not only is it something that we're trained for, which we'll go into, but the equipment that we have and why low-risk women have better outcomes when choosing a traditional midwife and an out-of-hospital birth. And that kind of answers the why is it safe to be able to go ahead and do that, right?
Right. Yeah, a lot of times we get these questions, well, what do you guys do? And they often will confuse us with like doulas. So, and I always like to clarify that. So as a midwife, we are a healthcare professional that takes care of you medically. We obviously are on the holistic side of it, the more naturopath side of it, but we are taking care of you and your baby medically. Whereas doulas are there to take care of you, emotionally, physically. They're really there to support you through labor, through postpartum. They're there to provide information, education. We do all those things too. However, it's different. And when doulas and midwives work together, we love it because it's just a win-win for both of us.
Yes, outcomes are very high with what the birth style you're looking for.
Right.
With the birth style you're looking for. So what we're going to do is Sandy's going to touch a little bit on how we get to become midwives and the training involved in that. And then we'll both go into the equipment that we carry and why it's so important that when you are choosing an out-of-hospital birth that you do have a professional there.
Right.
Because that's what makes your outcome good. It's not just like, doing an out-of-hospital. I know there's a lot of different, things going on now with people birthing outside, and we strongly feel that it's important to be with a professional wherever you are.
Because anything can happen.
Yeah, and we're trained in out of hospital, so it's very comfortable for us. So we know what to do and how to do it because this is our area of expertise. Whereas if we walked into a hospital, we wouldn't really know what the heck to do, right? So same thing, right? And same thing with vice versa. That's their area, this is our area, but both professions that are skilled in those areas. So what do we need to do to become a midwife?
Well, for one, we have to go to school. And just like any other profession or career, we do have to study for it. And our program, our direct midwifery programs are here in Florida.
Yeah, right. We're specific to Florida when we speak, really, because it is different for a lot of places.
In different states, right, exactly. So there's different types of midwives. So I'll go into direct midwifery, which is a 3-year program, and it's an intense program. I mean, you are basically...
it's not like a bachelor's where you can take all these classes like English and stuff that you don't really use.
Right.
All of our courses and training is geared specifically for midwifery.
Yeah, and there's also pharmacology, there's anatomy, there's the regular classes, obviously, but...
all the medical classes that you need.
Our program was so intense that we couldn't even have jobs. I always call it midwifery boot camp.
It really was. Yeah.
But I mean, you're literally going to births at least 3 times a week. You're doing clinicals 2 times a week. You're doing classes 2 times a week, and this is for 3 years.
Yes.
So it's a very intense program. And when you're done, you have to sit for your state boards, and your state boards you have to obviously pass in order to get your license to be able to practice. Not only that, you have to be certified in CPR, NRP, which is neonatal resuscitation. You also have to carry...
And these are things that you have to refresh your certificates every 2 years. Along with our license, we also have to can do continuing education classes.
Right, and recertify our license as well.
Right.
And we also have to carry malpractice insurance, which is also that's a controversial issue because there's a lot of doctors that choose not to carry malpractice insurance, whereas licensed midwives are
have that.
required by law to carry malpractice insurance.
We
So
don't have a choice.
that's something I wanted to point out.
Yeah, that's really fun. Really just loves my bank account a lot.
Yeah, and so just to give you the gist of it, when we graduated with 150 births under our belt.
Yeah. So our school was, like she said, a boot camp. So the requirements that we needed to graduate are not the standard. They are way above the standard, which is why we chose that school, because it really does push you to the max with learning and stuff.
Yeah, I mean, we had...
We also, it was 150 births we had to attend. We had 900 clinical hours that we required, and then a few other things. But one of the things I really liked about it is because it was an international school, it trained us in everything that could possibly happen without the luxury of having a hospital within 30 minutes away, because not everybody out of the country will have that. So the school had people coming from different areas to come and learn, so they could be ready for a catastrophic event without being able to go to a hospital. So we learned a lot of stuff that we'll never get to use, but it was really great.
Hopefully never get to use.
Well, right, yeah. And we're very lucky that, where we are, there are hospitals all over the place.
Right. And, going back to that, it's really important that people understand that the training that all midwives have is for that. Now, the difference between us and, let's say, a certified nurse midwife is they go to nursing school first and then they start their midwifery program. But they typically just work in the hospital. They work under a doctor. For the most part, they have to get signed off by a doctor.
Right, they have protocols.
They have different protocols than us. So some people choose to have a midwife in the hospital because she has hospital privileges, and then some people choose to have a licensed midwife, which is out of hospital, whether birth center or home birth.
Right. So traditional midwives like us are autonomous providers, which means that we don't have sign-offs, right? So we are responsible for everything.
We consult,
that we are doing.
but yeah,
we do consult because that's the right thing to do. But we are responsible for all of the choices that we are making. So we always that continuity of care that we provide to our clients is really important because it allows us to kind of give better care.
Right.
So
let's talk about the equipment that we have, because that's also a big question. I've had moms where they're like, oh, you do IVs? Absolutely. And remember, this is exclusively to Florida because there are some states where they don't allow licensed midwives to do IVs.
Yeah, that's insane. There's also some places where they don't allow Pitocin to be used by a midwife, which is, you are directly affecting my ability to provide proper care if you take away my ability to give Pitocin. I mean, how can I provide good care to a mom if I can't help her with a hemorrhage? Now, obviously, we are very well versed in herbs and homeopaths, but sometimes we need medication. And that is why one of the things that we carry is Pitocin. And we only use it for postpartum issues, right? But our first go-to will be either homeopaths, or we have a million different herbs. I didn't bring them all out because we have a lot.
Right, or different techniques too. But if we have a postpartum hemorrhage, which means the mom is bleeding way more heavily than we would like, and which is out of the norm, we would be able to administer an injection of Pitocin, and that usually will help to clamp the uterus and stop that bleeding, or at least slow it down so we can get it under control. We do carry antibiotics, and the reason why is because for a few different things. For example, if a mom is GBS positive, which is the group beta strep, it's a bacteria that all women carry in their vagina. It comes out at different times of our life. I may have it now, she may not have it, and honestly, there's no symptoms, it's not contagious, but we do test for it at the end of pregnancy.
The vagina is not a sterile environment.
It's not supposed to be. It has lots of good and bad bacteria.
Yeah. Right.
So, but if it's active, the protocol is to administer a dose of antibiotics during labor. And there's, the reason why, so that the baby has a dose to fight off that bacteria when they come in contact with it.
Yeah.
And then the other reason we use it is if your water breaks and your water has been broken for a certain amount of hours within our protocol, we would administer it, because then that's considered you're more at risk for an infection because your water has been broken for many hours.
Oh, wow.
Exactly. And the way that we would administer that is through an IV. And so we do have IV solutions for hydration, for a little bit of boost of energy, or for just giving you your antibiotics or something that you need.
Right, exactly. Now, emergencies can happen in labor, even
Mhm.
low-risk moms, which is why you should have a professional there. And this is also why we carry and we have our NRP certification, right?
Mhm.
So we have to carry certain equipment, oxygen being one of them,
That's right.
all the resuscitation equipment. Yeah, Amber, I don't know if you guys, it feels like you can't see it. But anyway, we have to have all of these things so that when the emergency does present, we have the tools that we need to be able to address it and go back to nice.
Mhm.
Right?
Yeah, and during labor, we're monitoring fetal heart tones with the Doppler, which is this right here. Some people have a fetoscope, some Dopplers look a little different, but typically we're monitoring intermittently during labor. We really try to respect the mom's space and her privacy, and we try to not be so invasive when we're doing our normal checks and vitals. We're checking the blood pressure, and basically throughout the whole prenatal care, we're also checking heart tones, we're checking blood pressure, we're checking temperature, the normal vital signs.
Yes, all vitals are being checked. That's how we know mom and baby are doing well, and if they're not, we can start addressing it right away instead of waiting until later, which we don't like to do.
Exactly. Yes. So during the pregnancy, normal vital signs, we do all of their lab work. We do actually draw blood and we do labs ourselves.
Yes.
We send our moms for ultrasounds. And so the way that I always explain it to moms is, we do all the same amount of testing as an OB would do it. We see them on the same schedule. We probably don't do as many ultrasounds, but if we need to, we can. And we are constantly monitoring our moms very closely. As a matter of fact, our visits with our moms are anywhere between 30 minutes to an hour. And that's because we need to have a close eye on these moms. So if something presents out of the norm, we're going to know that it's out of the norm. For example, I just had a mom that all through her pregnancy had beautiful blood pressure, and all of a sudden it started creeping up higher and higher. Because I know so much about this mom, and because I've been monitoring her and really keeping track
and keeping up with her proper prenatal care,
right, and all of the recommendations, I was able to properly monitor this a little bit closer and make plans, for addressing it as well.
Right. And obviously, I think the thing that people like a lot about midwives is our understanding of old techniques that have been used and have been very helpful for women who are choosing to do a natural out of hospital birth. Like, we have, wrapping of the belly, we do the birth stool, we have the aquatherapy, the birth ball. So, these are things that we have. It's not really today's subject. Today's more about emergencies and understanding why it is safe to do an out-of-hospital birth for a low-risk woman. I mean, this is actually proven to show better outcomes for you guys. So, we kind of don't just wing it.
Right.
We really know
and,
what we're doing.
In general, midwifery has been a profession since before doctors.
Yes. This is how all you babies got here.
That's right. I mean, my mother-in-law was delivered by a midwife, and so was her mom. And so
you can only go back a few generations before everybody was delivered by a midwife.
Exactly. It's interesting to me when I have moms that come from like a third world country or something, and we say midwife, and they automatically are like, no, because in their country, midwives are what they have access to, because they're not at that high status where they can go to the doctor.
And
whereas
also
here,
their midwives
it's the opposite.
Their midwives are, and this is what I love about being able to incorporate the best of both worlds.
Right.
Old world knowledge with modern technology.
And having access to
it. And having access to
it. Because
well.
they don't have access to hospitals. They don't have access to all the equipment that we have. So in their eyes are like, oh my God, but they don't understand that here it's an actual...
It's a blend.
It's a profession. It's a professional profession.
Right. So that was it today. I just wanted to let everybody know.
Well, also let's talk about, we also know techniques that sometimes in the hospitals they don't know, like dystocia and stuff like that.
Yes, well, right. So because we do not mess with the natural flow of the hormones and the labor progress with a woman, it really helps us to, when we do intervene, it allows us to do it in a very effective way. For example, if we have a mom who, let's say, got an epidural and can't really feel a lot of things, and then there is something like a dystocia that presents, it's really difficult for a provider to help when you and I are not able to do the things, the recommendations together, because you're numb or you can't move, and then I can't do what I need to do because of that. So it really does benefit both people when you don't mess with that flow. Because now when I go to step in and use my techniques, it works. It's
Right.
effective, right?
Right.
But also, I use these techniques more often because we don't use medication.
No.
So they're a little bit fresher. Whereas I know one time you were doing a birth and there was a doctor there who wasn't familiar with it, just or didn't know how to do it really, because they usually go to, and we're not knocking doctors. I mean, God, when we need them,
We're so grateful for them.
Their skills are awesome.
Mhm.
But if you don't use something, even for us, if we don't use a skill, we
Right.
will lose a skill.
Yes, that's
you
true.
know, and
Practice
so
makes perfect.
so we kind of keep fresh those older school techniques and skills that are really effective, but work well when allowing the body to progress as it should be,
Right.
without medication or intervention. You know.
Mm-hmm.
What else?
And I think that covers it. I mean, the main difference is that we are always going to first try our natural methods and our holistic focus, but we do have the emergency equipment, we do have the medication in the event that we do need it. And for you, for the mom, for the baby, you know, when the baby is born, if we put the baby skin to skin immediately and we don't mess with them, a lot of times because they are transitioning with their mom, they are regulating their breathing with mom, they're regulating their temperature, they're regulating their blood pressure. If we just leave it alone as it was meant to be left alone, really they balance out pretty well.
Yeah.
And they transition so amazingly. It even helps to regulate mom's bleeding postpartum too. So that's I
Things are
feel
put
the
in
major
place
difference.
by the universe for a reason.
For a reason,
The
yes.
body and the baby know exactly what to do. We just kind of have to allow that to
it.
happen and
Mhm.
trust that process a little more, and always be ready, but to trust that process and allow it to happen.
That's the main word, is trust. Trust that your body does still work, even though society tries to make it look like it doesn't anymore. Oh, you have to be induced, or you have to be this. No, if we just allow the body to do what it's supposed to do on its own time and trust that it's going to work, it really usually does.
A high percentage of times we have great outcomes because we left things alone.
Right.
Now, we do have the situations, and this is what I when we have a transfer and there is a receptive hospital, you know, kind of open and receiving our clients,
Right.
it's nice because number one, they know we have tried everything, because
Yes.
they're the doctors who are familiar with traditional midwives and all that we do. They know, okay, well, we know you guys have done everything this way. Now we're here to do the things that you can't do, in hopes that that can now help
Right.
baby.
And still give
And it's a really nice,
possibility.
right? It's a really nice transition when it's respected and understood all that we have done, and then now it's like, okay, well, now you need to step in and start doing those things. Now that we're going backwards and people are trying to double up and do the same thing, so
Right.
it can flow really nicely if everybody knows everybody's role.
Yeah, we hate transfers. Nobody likes transfers. The mom doesn't like transfers because that wasn't her birth plan. We don't
Really
like it.
neither.
We've spent 9 months with this mom, really establishing a relationship, getting to know each other, educating her, doing everything we can to
Being on call, being ready, being there.
to have this beautiful birth outcome that we all envision. And when we have to transfer, it sucks.
It does
But it's
suck.
really nice when we can have that open communication and understanding that, you know, there are times where we have to, where things can happen, and we are the type of midwives that understand that.
Yeah.
And we
I get
acknowledge
it.
that.
Mm-hmm. So, all right. Well, we hope you enjoyed this episode, and please give us. Smash that like button and subscribe, and give us some ideas of things that you want to know from two midwives who love everything and love midwifery and want to provide you guys with information. So thank you.
All right, bye.
Bye.